has enabled some provisions for how money is spent to specifically facilitate women's engagement in the training courses, with flexible timing delivery and the provision of accommodation for women, carers and children so that they can travel to courses and participate in the full training program. We have roughly a 50-50 gender split on training in that field epidemiology training program. The second example I want to give is in Papua New Guinea, where Australia has a large bilateral health program in partnership with Papua New Guinea. And within that, there was a program designed with a specific outcome to enable women in leadership. It's not a nice to have in this program. It's not a cross-cutting issue that we're thinking about measuring later, but from the beginning of the program, it's a measurable outcome. This program is called Sapotim Leader. And what it does is combine gender, social inclusion and disability advisory teams to provincial health boards in Papua New Guinea to help the provincial health decision makers make their policy and delivery more gender sensitive and disability inclusive and socially inclusive, but specifically has a line about the pipeline of women leaders, picking them up, training them, enabling, and any leadership training that this program delivers has to have a minimum 50-50 women to male participation. They're two very specific examples to reflect how having a core value of gender equality through our aid program is translating to work on the ground and in the field. It's not by accident. It's a mainstream long-term commitment by gender equality. It's about listening to evidence and being very deliberate in the planning of our investments. And we have had for about 5 years a terrific gender in health advisor who looks at our programs and says, you could do this, 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 and this better, and here's how I suggest to do it. So we have really tried to institutionalise how we make decisions about women in our health security programs in a very systematic way. In terms of the second point I wanted to touch on, how we have to think about this for the future, because we know it's not enough, right? We have to keep working. So we're currently designing a $375 million health security commitment to the region, to the Indo-Pacific region for the next 5 years. And in doing so, we are thinking very deliberately how we can do more, how we can make structures in our grants, our designs and our programs to enable more opportunity for women in leadership and a supportive ecosystem around them, better data for decision making, so really doubling down on disaggregated data on gender, on disability and social inclusion, getting our systems better to plan for disruption in the event of future outbreaks. And we know the absolute disproportionate burden that women who are unsafe in their homes suffered when the world locked down in pandemic. We need to plan better for that scenario. And we also need to continue to plan for the gendered impacts of health security and outbreaks in the future. We're doing a little bit better each time, but as we move forward, I think with this momentum and with thanks to groups like Women in Global Health who pull together the global experience, the evidence and the strategies that we as funders can read and take on board, we have a great chance to continue to make positive strides into the future. Thanks for the opportunity to talk today. I'll stop there.
Thank you so much, Dr. Williams. I would like to commend you for all your commitment in promoting women's leadership. And thank you so much for sharing what your country is doing in the region, because this will definitely have a ripple effect and it will benefit so many people. Thank you again for your time and joining us from Australia. So, distinguished guests, now we are in a time capsule because we are going from region to region. So now from Australia, we are going to Argentina. And it gives me a great pleasure to invite Ms. Sonia Tarragona, Chief of Staff at the Argentina Ministry of Health, to make her remarks. The floor is yours, Ms. Tarragona. Thank you.
Thank you very much. Good morning, dear colleagues, speakers, and all participants. It's a real pleasure to be here today. On behalf of the Ministry of Health of Argentina, let me start by thanking Women in Health, in Global Health, and the government of France for convening this relevant side event. We are really glad to support an initiative that challenges the current hegemonic power and privileges to build together a more just, resilient, and equal global society. Our country has a unique and cutting-edge regulatory framework on the rights of women and LGBTI+ people. For decades, we have incorporated the society's claims and fights for equality, non-discrimination, and eradication of gender-based violence. These social processes are in line with international legal instruments and enacting national legislations that acknowledge the rights of women and LGBTI+ people. The current government established the Ministry of Women, Gender and Diversity in 2019, prioritizing gender policies and claims of women's and LGBTI+ communities movements in the public agenda, and focusing on the cultural and structural dimensions that produce inequalities among genders. The Ministry of Health has also created the Directorate of Gender and Diversity. Our country has implemented a great number of measures with a gender-based approach in the world in the context of the health, economic, and social crisis triggered by the pandemic. On building back better from the COVID-19 pandemic, we express our concern on the fact that some countries of the region of the Americas may reverse the protection of basic human rights, such as access to sexual and reproductive health services. Therefore, we take this opportunity to call on other countries to also adopt measures to promote the comprehensive protection of women against any kind of violence, be it physical, psychological, sexual, economic, financial, or symbolic. Finally, we believe that significant progress on eradicating inequalities among genders is still needed, and to achieve that goal, we must ensure safe and decent work for women in health, put an end to informal work, promote equal opportunities and leadership in health decision-making processes and bodies, and eradicate violence and harassment all over the world. Thank you very much.
Thank you so much, Ms. Tarragona. Much appreciate your time in joining us. And thank you so much for the expression of support from your country to this very important initiative. Thank you, because we need people like you who are movers and shakers to, make sure other countries and players are motivated. Thank you so much for your time. And now from Argentina, we move on to Uganda. And please join me in welcoming Ms. Prosi Muyungo, who's a community health worker, Ministry of Health Uganda, and she will be talking about exploration of leadership at the community level. Over to you, Ms. Muyungo.
Thank you so much. I'm too excited today because I'm one of your speakers. My leadership is a call from God. On the other hand, it's an opportunity for my fellow community members. Mine is not a position of power, but it's about to serve others, taking responsibility, even in hard circumstances, like during COVID-19 pandemic. I had to help them to overcome the stigma of COVID-19 by helping them to follow the Ministry of Health guidelines and the protocol of COVID-19. As a community worker in my community, I serve more than 140 households. And I make sure all children in my community under 5 years are fully vaccinated. I give support to pregnant mothers. I also help them to attend their antenatal. I counsel about family planning. Those who are in need in short term, I normally give them at their houses. My client in need of long term, I give referrals and go direct to the hospital. In another hand, I'm a peer leader. I help where I oversee 10 CHWs. I help them to hit their targets monthly by sharing my experience with them. And I motivate them, I guide them. When I'm giving counseling, I normally hand one by one. For example, I can go with Hannah Field and see how she uses the Flipper book, or how she counts the first breath of the baby. I give the time for them to work. When we go to another house, I tell her that I'll be the one to handle the Flipper book. After that is the one who can say that, that one, I did it wrongly, but thank you. During the beginning of COVID-19, I joined the advocacy worldwide so that our voices as CHWs can be heard for our governments, policymakers, and funders. And they start counting us as community health workers, as the frontline health workers, and start paying our salary. The advocacy I joined, again, I was the one who helped to design the online course. I've helped even more than 20 CHWs to finish the course and gain the online certificate. Having women leaders in position of influence to serve as a role model is the only critical to the career advance of women, but it stands to generate broader society impacts. Women make amazing mentors. When women become leaders, they bring talents and new views. They inspire team and spend of time coaching their team. Women care a lot about their personal development. Women leaders emphasize teamwork. Through teamwork, we can get good communication, which is a key to success. Women are full of emphasis and compassion. They would seek to have the issues of everyone in the society. Improved women are great in the communication, networking, and generally great financial planners. They will ensure the gender gap and pay in the community and the country level. In conclusion, the women are the power of the agents of change due to their teamwork, mentorship, and motivation. Thank you.
Thank you so much, Ms. Muyungo, for your passion and your grassroots level work. This is so important. And also, it's really nice that you're using technology to educate. That is amazing. Next, from there, we move on to welcoming Dr. Vesna Petric, who is from Slovenia. She holds a very important hat. She's the current chair of the World Health Organization's executive board. Please join me in congratulating her on this very prestigious appointment, because she is really a great leader at the helm. And I think it's so good for all of us women all over the world to have you. And not only that, Dr. Petric serves as the Director General of Public Health Directorate at the Ministry of Health of the Republic of Slovenia. So you see a woman of formidable talents wearing many hats. The floor is yours now, Dr. Petric. Thank you for your time and your leadership.
Thank you very much, and thank you so much for organizing this, the government of France and also Women in Global Health. I actually had a little speech prepared by my colleague who is male. But I'm not going to read it out because obviously everybody had said almost everything that he prepared for me. So instead, I'm going to speak from, I'm not going to say my heart, but I'm going to speak about things that appeared to me when the others were talking. So yes, the fact is, and it's very important that we have the data and that we share the data globally about the positions of women in leadership and, you know, even about the improvements. And I was very sad to hear that it has been much better. I was not aware of this, that it has been much better even in the EB before, but I only know that just before or last year, there were only 2 women, as I remember, and now we are 5 in the EB. And yes, I was selected by the European region as a chair, and this is a really great honor to me. And of course, I do agree with all the colleagues that we have to permanently really focus on, you know, sexual exploitation, abuse and harassment, and make sure, you know, that this is totally unacceptable. And all the initiatives, even the ones in UN system, White Action Plan and gender equity, we have to make sure that they, you know, are, that people there are working and focusing on the right things. That is all truth. But on the other hand, I would very much support what my Australian colleague has said, that, you know, we have to invest and empower women to be able to be leaders. You know, because we have to invest in their education, but not even only in education, but making them confident by knowledge that they possess. And, you know, that are certain investments that have to be done consciously, because sometimes things are culturally, and there is very big diversity between countries, but we have to make sure that, you know, women get as much of a chance to get educated, even in leadership, as men. So that, I think, is one of very important things. The other important thing is, and I think Prosy has explained so nicely, you know, it's not only about being in a position. It is about being a real leader in the community. And when she was talking, she was making such a good impression on me. And I said to myself, she's a real leader. She is the one who is the leader in the community. It doesn't matter where she sits, you know, because she's a person who knows what to do and how to get a community, you know, to work together and try to sort certain problems. And that is another thing that I would also want to expose here or focus on this, because too often we are focusing only on the positions. You know, instead of looking at the great work done by the women, it doesn't matter which position it is, and, you know, promoting this great work and pricing it also, you know, this is what I think should be done a little bit better. And then she said herself, yes, we women, we have so many powers and we are good at many things, but one only thing that I think we could do better is networking. And that is why I'm so thankful to Women in Global Health for inviting me, you know, to work with them, to be at this meeting and so on, because I think this is my experience from many years before, when I was fighting for tobacco legislation to be changed in my own country and so on. I couldn't do anything if I wouldn't, you know, relate to others, get them involved with me, and also share then the successes, you know, and, you know, communicate on daily basis with so many, not just women, but also men, you know, to act together with the focus on a certain thing, which in this case was tobacco control, but it could be anything else, you know. And then I realized that, you know, men are very often, when it is about, getting to a certain position, they network a little bit better than we do. And support each other. That is my experience. I'm not sure that this is really truth. Maybe women, we do it also in a certain way as good, but I would like to investigate here, and I would like to know more about, how by networking we could push women in the leading positions, and make sure that there is better percentage of us being in a leadership position. Then also I would like to say that, of course, my focus is certainly, I'm a medical doctor and I'm public health professional, and my focus is definitely in this area. And in this area, as you mentioned, there are many more women, but in leadership, very often there are many more men. And during the pandemic, you are right, but in our case in Slovenia, we had a woman who was leading a group, that was deciding about how to deal with the epidemic too. She was a medical doctor. She is a medical doctor. Anyway, if I look at our ministers, there were, I think, only 3 women who were ministers. The rest, or 4 maybe, the rest was 15 or 17, was always male, So obviously there are differences, and we should find answers why. And I think answers were already proposed so many times, because women, sometimes we are in not privileged position because we have to deal with many aspects of life, and there we would need a lot of support to be able to also powerfully act at our job positions and, go ahead and become real leaders. But during the epidemic, I have actually understood that very often we speak of strengthening health systems, but we don't understand that this means strengthening. Actually, health system means investing in health system and in people working there. Because what we have seen, and predominantly there are women that are working in health system, we have seen how exhausted they were after 1 or 2 years of the epidemic, So many of them have left health sector and have started to work elsewhere, in particular nurses. And we should actually focus on this, because we demand so much of health professionals, which, as I said before, are predominantly, especially in care, women. Another thing that I have also seen is that we are not very good in engaging NGOs to support our work in health sector, and also in NGOs that are within the area of health, very often are women. In Slovenia, we do finance NGOs that work in health area, and we can clearly see the good work done, but this work is not 100% secure, because they are working on the basis of applying through tenders for the money for 3 years, 1 year, and so on. So these jobs are not secure even, and there are also, again, predominantly women. And then another thing that I have also understood during the epidemic is that health literacy of our people is challenged, or it's a big challenge now, because people nowadays, they get a lot of information, and this information, as we all know, is not always scientifically based. So there's plenty of information that people deal with and don't know actually what to believe and what not to believe. And here I think, as my colleague from Uganda, Ms. Muyingo, said, here is the role of women also, because it is in the family. Most of the time, I don't have data for Africa, I won't say that, but I know that most of the time, women are the ones that are taking responsibility for health of their family also. And they actually are the ones who are most interested in, about health of the family. So that we should make sure that they have the information and that the health literacy among women is rising, in particular about how to use health system, about things like vaccination, why it's important, why it's not. And here we need leaders. This is an area that we need leaders, and I'm convinced that the best leaders in this area, like health literacy, are, in my opinion, actually are women. These three areas, strengthening health system and NGOs getting on board and helping us, and health literacy are three areas where I anyway have my focus at home, and I always will try to promote this at the World Health Organization. But the other thing definitely would be equity. And equity, I was very much surprised that we still have diseases that could be cured, that there is medication for those diseases, but unfortunately, there is lack of will, or I wouldn't only say lack of will, it's a kind of an ignorance, that, for example, leprosy, that is still there in Africa, in Sudan, for example, that we don't take care about this. And this is one area where I will openly tell you, I need your support. I will try to get this right. I will try to focus on this, not just while I'm president of the EB, but also later on, because I think, yes, Slovenia is a small country, but equity here is very important. We have strong advocates, NGOs, and they have actually made us know about the situation. Slovenian NGOs have made us know, philanthropists, that there is a situation in Africa where actually it's ignored, and we cannot look somewhere else now and ignore it also. We have to do something about it. And I really, really would appreciate any insight or whatever, for me, how I would be able better, as the EB member and the president now, make sure that, we overcome with this situation and get the medicines and get the treatments in the countries where leprosy still persists. Because we are focusing only on COVID now, like anything else exists, but this is something that we could do. And I wanted to put this on the agenda of this meeting, because here I believe there are activists, there are women with great power, and I'm sure you will be able to advise me how to approach this. Because to be honest, I want to share also this with you. We are not always as knowledgeable as we would want to be. I maybe know a lot about public health, but I don't know enough about politics. So we were ignorant to the political situations, and we thought, that Slovenia just gives some seed money and everything will start working with WHO in Sudan and so on. It's not that easy. So we have to also take in account cultural differences if we want to succeed with whatever we do. And I'm sorry, it's a little bit out of the, just speaking of women. What I want to say is I'm really happy to be here, surrounded by powerful women, and here is a chance that we work together and do something good in the next couple of months and years. Thank you very much.
Thank you so much for your Dr. Petrić. I mean, you have held all the attendees all over who've joined Spellbound. You are a true leader because you have been inclusive. And I think one very important takeaway message for all of us, you have so many messages, is that you are so open and transparent about being inclusive, which is the true hallmark of a true leader. More power to you. We look forward to working with you. Thank you again so much. And I would encourage everybody to look at the chat where we have the latest report from the Women in Global Health, which is there, which is titled Subsidizing Global Health. And we found that upwards of 6 million women worldwide are subsidizing health systems with their underpaid or grossly underpaid labor. I would encourage all of you on behalf of Women in Global Health to check out this groundbreaking report. And, you know, as Dr. Petrish said so eloquently and wisely, and looking at some of the comments from our other women leaders and people who have joined, is we are only as strong as our team is. So thank you again. So ladies and gentlemen, please stay seated and listen, because now we have an amazing high-level panel discussion. And I am very briefly going to mention the three panelists. Again, their bios are on the website because due to lack of time, and we want to hear as much as possible from them. So our first high-level panelist is Professor Agnes Binagwaho, Vice Chancellor of University of Global Health Equity, Rwanda. So we are now in Rwanda. Thank you so much, Dr. Binagwaho, for joining us. And then we have Dr. Francisca Crispi, President, Regional Council of Chile's Medical College. Thank you so much, Dr. Crispi. And last but not least, we have our own Ms. Nurhan Nomier, who is a co-founder of the Women in Global Health chapter in Egypt. Thank you so much, ladies. Welcome. And as you can see in this panel, there is a regional distribution, and also we have our youths too. So the motto of this panel and WGH is leave no one behind. So that being said, please let us have this. So each of you is going to be asked a question, and you have 3 minutes to make a statement. And then you will be first asked to make a statement, and then so I will go around, and then again, I will reverse the order. So I will first start with Dr. Professor Agnes, and then I will move on to Dr. Crispi, and then I will move on to Nurhan, and then I will again, go around anti-clockwise so that we're all covered. So thank you so much. So Professor Agnes, from your experience as a woman leader, why do you think men hold 75% of leadership roles in health when women are the majority of workers in the health sector? And also, I just would like to say, in the spelling of woman, W-O-M-A-N is a man. So why is it that there is no equal distribution in the leadership role? So over to you. Thank you so much.
First of all, thank you to having me in this great panel with these great ladies. That's a very, very good way to have a good piece of time in my day. The question is very important, but to answer it, we need to go back to the continuous barrier, systemic barrier women are facing in communities and in societies. Women has less access to education. So when there is a number of people to select for some leadership position, we have less women than men. So there is less women that are recruited, except if you go with a policy who says this is the minimum number of women we need. But even though in all countries, women are more in numbers than men, the majority of the countries in the world. However, those quotas say 30%. It's not correct. We should say 50% of women should be in those positions. Second, we have the cultural ideas that women has to run the house and they have a full-time job outside where, remember, we have to be more performant than men. If not, any little mistake, is because we are a woman, not because we just make a mistake as an expert. So we have more work at work. We have to do the work at home. So we are superwoman. We have no time in our life to be who we are. So this is one of the reasons. Second, because 75% of policy and decision makers are men, and 73% of the leaders, for example, of 200 organizations active in global health are men. Why do you want them to think about us? Okay? There is no reason, you know, you always, first of all, if they were thinking about equity, they will resign and propose a woman in those positions. And it's not the case. And the problems start at community level, in family level. We need to promote, and I love the ideas of networking. We need to promote very successful women, showing to families that you can come from a very modest origin and became a great lady worldwide, so that they start to invest in women. Because if they invest in their boys, it's just because they know that boys are sustaining the family, and that's not true. So those are some of the reason why women lag behind. And also now inside, when we have the position, the majority of institutions pay less their women than their men. And this is also something we need to fight. Inequity is all over. It starts in communities, in families, it's continued at work and at national level.
Thank you so much, Dr. Agnes, for those remarks, which really, kickstarted this great panel. Moving on to Dr. Francisca, I would like to ask you the same question. From your experience as a woman leader, why do you think men hold 75% of leadership roles in health? And this is worldwide, as we know, when women are the majority of workers in the sector. Thank you so much.
Thank you very much. Good morning to everyone. And I want to, in the first place, thank for the invitation to such an enriching event. I think building networks that promote women leadership are so important to reduce gender inequalities. I think the reason because there are more male leaders in the health sector is because of the so many barriers that women have to get to the leadership positions. I think women are perfectly capable of everything. They are excellent workers. They are excellent leaders. But during their lifetime, their work life, they have several barriers that we experiment here in the work centers. And I see them daily among my colleagues. A big barrier is the double workload that women have. And I think the pandemic has increased the double workload. Women have to take care with a higher responsibility of their home, of their child, or also caring for elders. And at the same time, they had to be working. They have to work in the formal work or in the health sector. And that double workload is very difficult to cope with in a context that you don't get any support from the health system in order to make them to make it possible to work at the same time both works. And also because there is a lot of discrimination in the health system towards women in their maternity leave. For example, we get daily women that their maternity leave is not respected, or they have barriers to have their maternal rights. They come back to work after having a child, and they don't have a place to do breastfeeding to their kids. And those are barriers that tend to start leaving behind women that are perfectly capable of getting to the leadership position. Also, I think that sexual harassment is and other types of harassment are important in reducing the working spaces for women. Still, women are harassed, abused during their working hours. And that it's a way of saying that the working world, the formal working world, is not for women. It's a way of excluding them from their working positions. And all of these different barriers sum up to diminish the possibility of women to get into the leadership positions. Also, all of the stereotypes that are attached to the women experience, that you are not prepared to be a leader, that women are too weak for being a leader, that leadership has to be competitive and women are not competitive. So all of those stereotypes that we have been growing up with, I think they're very important to reduce the opportunities for women to get to the leadership positions. So I think there is nothing to do with their capabilities, of course. They are perfectly capable and they have very interesting characteristics that they make amazing leaders. But the system and the lack of protection of the, for instance, the maternal rights or protection of women against sexual harassment make the perfect environment to reduce the possibilities for a capable woman to get to the leadership positions. And we miss, and we all lose with that situation.
Thank you so much, Dr. Francesca. What a nice compliment to what Dr. Anya said. You know, so this really shows that we are building a three-dimensional puzzle because everybody's contribution is so important. Last but not least, Ms. Nurhan, what do you think from your experience as a woman leader, a youth leader who's done so much of work, made inroads in your country? Why do you think men hold 75% of leadership roles in health when women are the majority of workers in the sector? And after this, the second question, I'm going to start with you. And may I respectfully request our esteemed panelists to shorten your remarks to 2 minutes because people are so excited. We have some more questions I want to cover as much as possible. Thank you. So Nurhan, the mic is yours. Thank you.
Thank you so much, Badini. I'm very happy to be there today with you. And I'd like to express that I'm honored to join today's event, being discussion with amazing women leaders from Uganda, Rwanda, Chile, Slovenia, France, Argentina, Australia, and the US. To just give you a glimpse about my background that will be reflected in my my ideas about different parts of women in leadership. So I'm the co-founder of Women in Global Health Egypt, one of the first chapters in the MENA region. I've graduated in 2018 with a bachelor's degree in clinical pharmacy, and I'm now doing my master's in public health from London School of Hygiene and Tropical Medicine. To give you a glimpse about the Egyptian context, if you're talking about leadership, being inclusive or not, or exclusive for men, as global leaders in politics, health, academia, and other sectors, you've been discussing about how to build back better. I'm keen to highlight today why it's important to build back, especially to be more inclusive, having women and men having equal opportunities in leadership. For me in Egypt, it's not about a certain reason why men are taking more positions into leadership, rather than in every aspect, it's different. From my opinion, in Egypt, it's more of that it's discouragement of the community to have women in leadership positions. As Dr. Francesca and Dr. Anies said, that women have more responsibilities at home with their families. So they always have they're more overloaded at work, having double jobs and full-time job and a full-time job at home. It's a full-time job. I can call it a full-time because she's responsible for everything. So whenever there's a leadership position, they always searching for a man that has more time for the leadership position. Also, there's an underrepresented women leaders in my community. Women leaders must be seen, must be there to support other women leaders that want to go into leadership positions. Also, women that want to make it into leadership positions don't have mentors from women who are in leadership positions. And this is very, very important. If I'm now wanting to be there for a leadership position and I don't have someone to mentor me from the women community, it's very hard for me to get there. Therefore, that's a reason why we started Women in Global Health Egypt, to have this mentorship for all women that wants to make it to leadership. So it's more, to sum it up, it's more of underrepresented women leaders and not enough support, and women being culturally indulged in more family responsibilities and home responsibility compared, of course, to the male or to the man. They don't have that responsibilities at home. Therefore, they have more time to get prepared for leadership positions. We actually are fighting every day. We're just working a full-time job. We're getting ready to take care of our families, a lot of responsibilities. And if we're not doing our responsibilities at home that much, we are called compromising women. We are called that we're not being capable of doing something. And actually, there's more of a cultural norm and stereotype, as Dr. Francisca said, that stereotype that we're not capable of doing it. And we're capable, we're fully capable. We just need support. We need mentorship. We need equal opportunities for men and women. Thank you so much.
Thank you so much, Ms. Nurhan. You bring up something, support. That's why we are all here together. And by supporting each other, we become stronger, because 10 hands joined together are stronger than one. Thank you so much. And one thing I just want to say before I ask the next question is, I always tell my young medical students, residents, or anybody I talk to, including my own daughter, if you don't have a seat at the table, pull up a chair. So we always need to make sure we carry a stool with us, because how they can throw you out once, but they can't throw you out 10 times. And if we all keep pulling up our chairs as women all over, we will be taken seriously. Thank you so much for your passion. And, hopefully together we can all make a difference. Now, the next question is to you. Women have been advised to lean in and be assertive to get into leadership roles. So my question to you, ladies, starting with you, Ms. Nurhan, is, should women lean in, or should we be asking men to lean out of leadership to make space for us? Thank you.
Okay, in my opinion, from my culture, from the place I'm coming from, Egypt, I don't think that's a good approach to ask men to lean out. I don't want to make it a fight. I just want to make it something inclusive, something having a place for men and women based on their capabilities, based on if they are going to be doing the job in the way that it's required to be done. It's not that I want to push the man, I'm going to take his chair. As you said, take a chair and sit and open the discussion that you are capable of doing it.
Thank you so much.
Okay, thank you so much.
Thank you. That was, thank you for your response. Now, over to you, Dr. Francisca. What do you think? Do you think women need to lean in, or we need to have men lean out? I appreciate your input.
Yeah, I agree with Nurhan. I think that the more than the participation of women or men, there should be the mechanism, the structural mechanisms for parity. We have to learn as a society that we will benefit in all the grounds if we have parity in the decision making. If women are excluded from the decision making, there is a half of the world experience that is missed. And we miss an important living of the world that is important to include in the decision making in order to make policy that are responsive to the needs of all of the population and not only the half. So it's important that the structure is available for parity. I think women should not adapt to a kind of leadership that is not familiar for them. They don't have to enter a leadership that is competitive, that is aggressive. I don't think that's the way. I think the way is to make spaces for all kind of leaderships that are constructive, that are capable people, but with the parity as a goal and as a tool for reaching better policy making, and also policy that makes sense for all of the population.
Thank you so much. Now, Dr. Agnes, your input, please.
I'm going to contradict a little bit my two sisters here, because I believe that it's not only men are not like that because they don't know. They know very well. It's a power dynamic and they keep it. So if we don't oppose, and I don't say we need to fight, myself, I have spent my time fighting with words, writing, evidence, research, etc. But we need, it's a fight, you know? And if we don't do that, men will continue. They know. And women knows as well, but they don't fight. Like at home, we all know that we should share the task. How many women stand up and say, now we are going to share because I feel I'm abused? No, women are the majority of the time, accepting the norms, because we are not fighters. We are not, like you say, Francesca, we don't have the same level of testosterone. That is the level of the hormone, I guess, that make them fighting and want to be. But we need for our daughters to create a more equal world. And we will never do that just by waiting the goodwill of the men. They know they don't move. We know we should move.
Thank you so much. See, that is why it's so nice to work in a team, because you get different viewpoints. Now, Dr. Agnes, the next question is to you, because I'm following the clockwise and counterclockwise. As a woman in the global health sector, can you please describe to us any action you have taken to support early career women to advance their careers and get ready for leadership roles? This ties into what Nurhan said, that, you know, mentoring is important. As somebody who's now the Chancellor of University of Global Health Equity, you're really a champion. So could you please share your insights into this? Thank you so much.
Thank you. So I think it depends the position I had. Now it's in academic. Before I was in education, but not at the same level. What I do now, I better talk about it, because I did a lot through mentorship, taking young researchers, young leaders, even leaders that are not in my field, and have a mentorship, really an organized one with a monthly meeting and review of achievement and advice. But now what I do, because we have less doctors, women than men, so we take 70% of the enrollment in the medical education are women. And we accompany them. If they want to be pregnant and deliver 1, 2, 3 times, we don't care. We will accompany them up to they got their diploma, except if they don't want, because they found that it's not their goal. So this is what we do. We have a Center of Gender Equity that assures that gender equity is in all our policies. And you could be surprised how even when you have a good will, you miss some points. So audit what we do through that center is also key. So those are 2 things I'm doing now. But all along my life, I did it. And I even say that I pursue hard studies just to show women that you can do it. And I make sure that in the ministry, everybody got access to a master's degree and PhD if they were willing to. And I say everybody to make sure that the women were included.
Thank you so much. Now, Dr. Francesca, would love to hear from you, please.
Yes, I think First, that the women leadership spreads like wildfire. When you, I remember the first women president of the College of Physicians. She was very important to open the College of Physicians for women. And after her, I think a lot of women, we have been called for getting to leadership positions because of that experience. So I think that women in leadership positions, it's already an important action, because it spreads, and other women will get and will see that it is possible and it's good, and that that women get to those positions. What we have done in the medical college, we implemented gender quotes for the elections, and that they have been really important. We had a council that when we arrived had only 3 women out of over 20 councils, and now it's half and half. So it's a very different experience of how the medical college, what are the ideas being promoted, and what is the experience being seen in the college. Also, we created a unit of legal defense of women with gender problems at work. And we have been impressed of all of the colleagues that have reached the legal defense unit because of problems at work due to sexual harassment, maternity issues that have not been protected, or rights that have not been protected. And that unit, I think, has been very important to make women know that those problems are not their responsibility, are the system's responsibility, and then they have a support behind them that can help them with these situations, in order them not to be a barrier for her work and her working life. And also, lastly, we have promoted the creation of women's group in the medical profession. We have several organizations now that, for instance, we have the Chilean Gynecologists, that is a only women organization. And you see that when you have women in these organizations, they have other topics being covered. They are doing an amazing work. Also, we have the feminist medical workers as an organization. And I think they all promote a different view of medicine, that it's more gender equitable.
Thank you so much. And thank you to both of you for bringing up the quarters in the medical school. And those of us who are in academic medicine see the change where there are more women enrolled now. So I haven't forgotten about you, Ms. Nurhan. So what do you think about, you are really a trailblazer in a country which is a patriarchal society, and you've been making inroads. So can you describe any action you have taken to support your peers, other early career women to advance their careers? So thank you. The floor is yours.
Thank you. Thank you, Dr. Badmini. So the first step is, of course, co-founding Women in Global Health Egypt. That's the main platform for supporting other women in early careers. So I'm happy to share that we have started this year, one of the first chapters in the MENA region, and actually the first in the MENA region. For me, on a small scale, in my daily work, I'm always there to support young women. I'm still in the young community because I've just graduated in 2018, but I'm supporting the community as well, in terms of if there's anyone applying for a job that needs support, that I know more about it, I'm there to support. We schedule a one-to-one meeting, and I'm just adding my insights and how to support. If there's any courses out there that can support other young ladies or that wants a specific career, I share them. I share it with them. So it's not majorly a big one. The big step is Women in Global Health Egypt for me. on a small scale as in a personal insight that I always help women around me in reaching their goals and careers. And for example, in my master's, I'm doing my master's in LSHTM, and I'm the student representative, the elected student representative. And we're always making sessions about different career pathways to support other women and other students regarding this part. We make like leading sessions, how to choose their subjects, how to choose their career pathway. So I just wanted to say that I do both on a small scale, and the large scale is Women Global Health. And thank you so much.
Thank you. So again, I have the final question here before we have a speed round. So again, I start with you, Nurhan. So do you think men and women have different leadership styles? And what do you think are the differences, and what impact do they have on health sector? Thank you.
I can generalize. For me, it's not something that I can generalize. Every man has specific leadership style, or every woman has specific leadership. It differs, of course, but the most prominent difference is the empathetic part. Women have more empathy, and it's very. We were created like that. It's very obvious in any work we're doing. We always see the colleague or the one working with us on the part of the emotional part. We make sure that our team is always on the same page. Our team is satisfied with what's being done. It's not the same, of course, for every woman. It differs, but the empathy is there, and the detail-oriented part of the women. Women are more detail-oriented in the leadership. They make sure that everything is on the right track. Everything is there, and also they have this leadership juggling part. They can juggle a lot of things in their leadership style. They are more of a multifunctional. But of course, this differs from every woman to another. This, of course, impacts health system in different ways. If the women are leading, they're always looking onto details. Actually, women tend to be more hard worker in terms of making sure that every step of the process to the outcome is being done, not the outcome itself. They more tend to be hard workers, not an outcome based. They reach the outcome, but they look into details, and this affects the health system, of course. If they're looking into details of the process of their leadership, the outcome is different. They're making sure everything is working is right and working good. For men, it's always the smart worker, the smart leadership technique of we look at the outcome, we don't look at the different steps in leadership. That's my opinion of what I've been doing here in my different leadership roles I've been taking. That's all. Thank you so much. I leave the floor to Dr.
Thank you.
Francesca.
And before I let you go and move on to the others, in 30 seconds, because this is a final fire question, it needs to be fast. And I love Francesca's quote of women leadership is like a wildfire. Thank you so much. So what is the one piece of advice you would give to women who aspire to be leaders in the health sector? You have 30 seconds.
Who's that?
Yeah.
Goes to Nurhan, and then I will come back to you. Thank you.
I would definitely tell them to seek mentorship. Seek mentorship from leaders, other women leaders in the region, talk with a lot of leaders, have different insights. That's the one piece of leadership advice that I would like to tell all women. Thank you so much.
Thank you so much. Really appreciate your insights. Now, Francesca, do you think men and women have different leadership styles? What do you think are the differences, and what impact do they have in the health sector?
I think that's a difficult question because I don't think that biologically women and men will have different capabilities. But of course, because of the stereotypes and the life experiences that we have different as women and men, we do get to have different ways of being leaders. And there, I think we can, in general, say that I value more that it may be associated to women, but I think it's not like biological, it's just like a stereotype. But I value more leaderships that are constructive, that are not competitive, also that they have more empathy, I value more also women that or leaderships that promote teamwork, shared visions, and also leaderships that are they have an ethical behavior in all of their ways. I think some of those characteristics have been associated to the women leadership, and I think that's what we have been missing in a lot of positions because of the exclusion of women in the decision making. But we should promote that both women and men have that type of leadership. I think the competitive and aggressive leadership, it's a way that we have been leaving behind, and that we should continue to leave behind. Cooperation is always a better way to reach our objectives.
Thank you. And in 30 seconds, what is the one, final round? What is the one piece of advice you would give to women who aspire to be leaders in the health sector?
I would tell them to be there, to take power. I think women, we have been so long invisible, and now it's the opportunity for us to take power, and that when we get to the power positions, the decision-making positions, we have the responsibility of showing the world what happens when women are leaders, that we see the problem of other women, that we see the needs of the half of the world, and that's why it's important to promote our positions. I think my main advice is to do it, to have our insecurities, to leave our insecurities behind, and to take power, because it is important for the organizations.
Thank you so much. Dr. Agnes, the floor is now yours. Could you please very briefly tell us how you think men and women have different leadership styles, and what do you think are the differences and what impact they have?
Okay, briefly, we need to study why, but we are different. Women are more inclusive. Women are when women are in leadership position, vulnerable are generally has a better opportunities. Even when there are many studies, even judges in US are linked with under 5 survival, the number of women in those positions. So we have different leadership, but it's good, Gender equity doesn't mean I don't want to be a man. Physically and mentally, I want to be my best self. And gender equity is allow everybody to be at his best self. Women are more inclusive when you put a woman in a team. The team in generally is more intelligent as a group. And this is the impact of women.
Thank you. Now, Agnes, the final question. What is the one piece of advice you would give to women who aspire to be leaders in public, in the health sector? And coming from you, who's, with your vast experience, this would be great. And you have 30 seconds. Thank you.
I will tell them first, follow your dream. You just be a leader in what you want. I will tell them also that in your dream, be excellent, because it will make everybody to never contest what you do for who you are, but to dialogue on technicity and skills. Find allies among women and men who are feminists, fight wisely, and don't confuse. It's not about you. It's about culture. It's about cultural misconception, etc. Don't take it personally, and network.
Thank you so much. I think this has been an amazing panel discussion. Thank you all for your great insights. And an important takeaway message from the speed round is be yourself. You be assertive, but not rude and inclusive. So thank you all. And now, last but not least, we have a special treat for us, because we have Miss Anne-Sophie Morceau who is Senior Advisor to Global Health Ambassador, the Government of France, and without whose help this would not have been possible, the whole initiative. And before I hand the floor over to her, I just would like to say, give a shout out to the co-founder of Global Health, Dr. Rupa Datta, and of course, the fabulous executive director, Dr. Magda Roballo, Anne Keeling, Becca Reisdorf, and all the rest of the team behind the scenes, because this is teamwork, ladies and gentlemen. It would not be possible without everybody chipping in, our fantastic speakers, our panelists, and also you audience. That being said, please stay with us as we move over to hear the very important remarks of Ms. Anne-Sophie Morceau from representing the government of France. And a big thank you to the government of France for your support. Over to you, ma'am. The floor is yours.
Thank you very much, Padmini, and thank you for the great discussion. Well, I'm joining you to thank the team of Women in Global Health. Without them, we won't be there. And well, dear Magda, dear honorable speakers, dear participants, I'm very happy and honored to speak today on behalf of the French Ambassador for Global Health. And I must admit, it's really difficult to conclude such an incredible discussion and very rich. So I completely agree with everything I've heard. And it's not as easy, I guess, but we will succeed. So thank you to all the amazing speakers who once again showed the strength and resilience of women health workers and demonstrate why we can no longer accept that health issues are discussed and decided without women participating in the process. The issue of women's leadership in the health sector, but not only in the health sector, of course, is a subject of primary importance for France, which supports through its feminist diplomacy and the many commitments it has made, such as the Gender Equal Health and Care Workforce Initiative. And we're very, very proud to be on that board, on that ship, and to count today 15 countries with us. And a special thank to Argentina, Australia, who are with us today, and lately Cabo Verde also joined us this week. And well, as you've said, we need to commit and invest in a structural movement to change the system, to strengthen health systems with a focus on resilience and reducing all kinds of inequalities that have been mentioned, gender, but also access to care and education, access to management position, and so on. Unfortunately, the inequalities are too many to put them all on the floor. And quality training, of course, is a major key to reduce gender gaps and ensure the availability and quality of human resources in healthcare. This is why France is committed in the creation of the WHO Academy in Lyon, in order to provide a space for lifelong learning and quality training for all global health actors, starting with health workforces. Besides that, let's be realistic. All over the world, women prove every day their strength and multiple abilities to manage both their professional and personal lives, the stress and pressure that both can bring. They are leaders by nature and the pillars of present and future society because they ensure the best health and education for their children while contributing to the current economy and growth. And I must admit, I'm the mother of 4 boys, and the pressure is huge because I need to educate them well to make sure they have this gender equality mind, and so they have this to change the software in their mind. But in reality, it's really, really difficult to educate them well. So, but I'm doing my best, and I know all women all over the world are doing their best. And we need just more confidence in ourselves and in our abilities to step up and make the difference and make sure our voices are heard. So together, men and women, because indeed parity is indispensable, and we are both complementary. So all together, we need to change the software and give women the place they earn and they deserve. And leadership in health can no longer be carried by men alone. Decisions that affect women can no longer be made by men alone. And health governance will be strengthened if women's voices are heard and taken into account. At a time when conservatism is on the rise, unfortunately and sadly, let's not give in. And we need to protect the rights we have and extend them for a fairer, stronger, and more resilient society. So thank you all for everything. And France is here. You can count on us. And thank you very much. Bye-bye.
Thank you so much, Ms. Mosso, especially for excuse me, sharing your personal insights. Your sons are sure lucky to have a mother like you in bringing up how to respect women. And again, just to add to what Dr. Anya said, is gender equality is being yourself. It's not in being competition. So we all need to work together. And thank you, everybody. The last thing is that on the chat, we have a link for you to leave your thoughts about the event. Please make sure you download this. And on behalf of the government of France, Women in Global Health, the government of Argentina, and all our distinguished panelists, it's been my privilege and honor to moderate this. Thank you all distinguished panelists and esteemed guests for your time. And together we can make a difference. And we are on time. Thank you all. Have a good rest of the day, evening, or night. Thank you so much.
Thank you, everyone.
Thanks.